Hello and welcome to America Salutes Its Veterans. Today we're going to ask why VA healthcare and why does it matter? We have Janet Murphy, and Janet is the director of the VA Midwest Healthcare Network. A big statement, Janet. Welcome, welcome.
Thank you very much
Thank you for coming.
Me, yes.
And we have Milton Schoen, who is the director of Veteran Service for Hennepin County. Welcome, and thank you so much for being here.
Thank you.
Tell us a bit about you and what is it that you do at the VA, and why does it matter?
Yes. Well, I have the privilege of honoring America's veterans by serving them every day. And my role and my job is to make sure that in any way possible the veterans get everything that they have coming to them in terms of health care and benefits and all of the services that they have earned by their service to our country.
Milton, how do you work with the VA? What do you do for veterans?
Well, we're the first point of contact. We enroll people in VA healthcare. We help them get the documents they need to get into the VA system. We apply them for VA benefits. But the most common thing we do actually is to obtain health care for people, and in a recession that is critical.
Right. And we have a lot of services to offer. My area covers a 5-state area in the upper Midwest, and in Minnesota alone we have 2 hospitals, one a major teaching and academic hospital that does all kinds of services, including very complex surgery.
And that's out on the VA campus.
That's right by the airport, the
Right.
VA Medical Center, Minneapolis. We also have another hospital in St. Cloud, which is primarily focuses on psychiatric. It has a very large community living center for folks that need longer-term care. A lot of outpatient primary care, and in next year, the beginning of next year, we will be opening an outpatient surgical center at the St. Cloud VA, and that is going to offer many more opportunities for folks in that area to get services.
And Janet, the VA is much more than just hospitals. Mm-hmm. It also has community-based outpatient clinics and Twin Ports Clinic and an array of clinics that tries to put health care closer to where veterans physically live in this state.
Absolutely. We really recognize that today's health care cannot be all centered around hospitals, and it really needs to be dispersed out to where people live. And not only do we have our own clinics in those areas, we have some contract clinics, and we also contract with local providers to orthopedics, cardiologists, and other kinds of services that aren't available necessarily through the VA, and we actually contract for those services to avoid having everybody have to drive 150 miles, 200 miles to see a cardiologist. So we are in a real partnership with folks like you and other community providers that provide health care and social services in the community, and it's a great partnership that works really well for the veterans.
Janet, tell us a little bit about your background.
Well, I have
You have a very interesting one.
Well, I'm a Minnesota native, and I grew up on a farm in southern Minnesota. Mm-hmm. And I left and went to California and have worked in healthcare for the past 30 years. And most recently, before coming back to Minnesota, I worked in San Francisco, and I was the administrator for primary care for the city and county of San Francisco.
And
so I worked
for hospitals?
I worked for a healthcare system that
Yes.
included the major hospital in San Francisco General Hospital. And so I was in charge of all of the primary care services there for general primary care, pediatrics, obstetrics and gynecology, and then all the community clinics as well that provided primary care services in the community.
What excites you about coming to Minnesota and working with the VA here?
Well, in addition to coming back to where my family lives, it's very nice to come home. I think you're always, home is always where you grew up. But coming back to the VA was really an opportunity to serve a different group of folks. I mean, we have the best mission in the world. We serve America's heroes, and you can't beat that mission.
And one of the things is that in this state we work together. The county veteran service officers, the VA regional office, the VA healthcare system. When our Guard and Reserve started coming back from Iraq as county veteran service officers, we've signed up over 7,400 returnees for VA healthcare, so the day they get back they had healthcare. there is this ability to solve problems that, and not be worried about boundaries, but figure out how do we actually accomplish outcomes for the people we're serving. And I think that's one of the things that's special here.
Right. And Milton and I were talking recently about how things have changed. And in the VA, we have an incredible range of ages that we need to provide services for, all the way from World War II veterans to very young people coming back from the current conflicts, and many more women, as you and I have discussed. And so veterans today that are coming back from the conflict, they want different things. They want their appointment reminders, text messages to them.
Sure.
They don't want a phone call.
Depending on the age.
Yes, they want to communicate by email. And so we're really trying to provide those things.
And there's a desire for home-based care. As veterans age, they want to be able to get services in their home and be able to monitor certain things in their home so they don't have to come in as much. And in fact, if you have to travel a ways, it's much more dangerous if you're elderly to be transported, the chance of falls and things. So I know that's one of the major initiatives that you're working on in this region.
Well, I don't know, we haven't actually discussed this, Milt, but in our network we have almost 3,000 veterans who have devices in their home that allow them to send electronically their blood pressures, their weights, their glucose readings if they're diabetics. Some of them have pulse oximeters that can tell the oxygen saturation of their blood, particularly important for patients that have chronic obstructive pulmonary disease.
Now, is this in the 5-state area, or is this the entire state?
This is in the 5-state area.
Okay.
Yeah. And so those devices, the technology is really helping us move ourselves in a direction that we need to go for old and for young veterans.
And
What particular?
And it hasn't always been that way. That the VA has made great strides in adopting technology and using that as a tool to be more efficient and to provide cutting-edge care. And they were the first large organization to have an electronic medical record. The rest of the country's adopting that. There's a national formulary. One of the things that's been great as a county veteran service officer is when you have somebody who comes from another part of the country, you have the same psychotropic meds, and if a person is on those, that it's much more easy to stabilize them and to deal with those issues than to have a separate formulary for every facility in the country.
Right, and in fact, you mentioned the electronic medical record. If I could just make a quick comment about that. We are, electronic medical record, for those who don't know, is basically your entire record is in a computer. And so it's
For about 5 years. The rest is, all right.
Yeah.
Okay.
So basically anybody that has privileges and permissions can see what your health record is in the computer. So a really good example.
Do
of
you
how
have
this
my
works-
chart?
if you're a veteran, we probably have
You
it.
probably do.
We
Yeah.
probably do, yes. I wouldn't know that.
No, what
because,
I mean is,
you know,
as a patient of the VA, do you have a computer program that allows me to access my chart?
we have a program called My Healthy Vet that is beginning to allow you to access parts of your chart.
All right.
Right. You can't get it all yet, but you can order prescriptions on there. You can refill your prescriptions. You can enter your own health notes in there.
Sure.
And soon you'll also be able to see some test results. So little by little we're developing this product called My Healthy Vet, which is basically a way for you to go in and communicate with your providers. We have a new product called Secure Messaging, which is basically email.
Sure. Right.
So you can see appointment lists, and you can choose your appointment times. So there are a lot of new things that our technology is doing for us.
And there are all these changes that are being incorporated, and there's a new Fisher House that's coming online, and that provides housing for people who are being treated at the VA and their families. There have been some incredible innovations at Minneapolis. We've got Minneapolis Veterans and Community Housing, and the VA at one time had essentially one model for the whole country, and now there's this focusing in on how do we serve our customers, the veterans in our
Well, what I can hear you
area.
saying is that there's just a major changing in the VA, and that you're doing the very same thing that everybody else is doing. You're running to catch up with the needs of your patients, with the needs of your clients. How are you, and everyone is, everyone who is a medical service deliverer is. Women veterans there are many, many articles written about what's occurring in our society and how are women veterans being treated. What's occurring at the VA with women veterans?
Right. Well, you know, we've always treated women veterans, so it's not new for us.
No, it isn't.
But we have an increasing number of women veterans.
Yeah, and it was like 2% in World War II, 5% when I was in. Now we've got National Guard units that 20% of the members of the unit are female, and so the demographics of who we serve are changing, and the institution is trying to figure out how to accommodate.
Right. Now here's a fact that I'll bet you don't know. I bet many people don't know that the VA now treats newborns for the first week of their life, and the VA provides health care for newborns that are born to women veterans. In their first week of life, we provide the health care for those newborns. Now, I don't know if that's something that is a surprise to most veterans.
I think it's a surprise.
Yes.
Well, it's a surprise in that you treat veterans and you don't provide service to non-veterans, and that's always been a challenge with the system, and to figure out how to make it relevant for your veterans today.
Right. We're providing labor and delivery. Now, mostly that's done on contract because
that's a big impact.
That's a brand new for us. Prenatal care, all new, right up through delivery in the first week of the child's life. So that is a huge change for the VA, but it's something that we need to do, and that's part of how we're evolving for those women veterans.
So that is part of the impact that women veterans are having on the system. How does the fact that women are mothers are still primarily responsible for their children, how is all that working with the VA? I have gone to many meetings with women veterans there who are saying those are issues that the VA has not thought about. Daycare, mental health treatment, drug treatment. The fact that we don't have somebody at home taking care of our children, and that we are the primary caregivers and folks responsible for our families, and still we need to seek treatment for ourselves.
Well, I would say that the VA faces the same problem that any healthcare system has when you have, for example, a single mother with children who needs to come into long-term drug treatment. We are no different. We need to find solutions for those women as well. So many drug treatment programs allow women to bring their children with them. That's where we need to go. We need to make those kinds of provisions just like other healthcare entities are doing for their women. One of the initiatives that we've got going right now is we're asking all of our facilities to look at their space and give us proposals that we will fund to make space for women's services kind of more separate, more women-focused, more private. And
I know the article in Sunday's paper said even the examining rooms face toward people walking into the VA.
Well, that's no longer. That's all been changed. Or
that's good to hear.
It should be changed. Right. And you know where that comes from, I think, is that the lack of experience serving so many women.
Sure,
so
absolutely.
You know, we're learning, and the women are telling us. They're telling us what they want, and you know, we're listening to them.
We always look toward the military, actually, to be the leaders in many areas, because they were the leaders in, I believe, in integration, in mental health delivery in so many cases, in drug treatment delivery in so many cases, and they will be the leaders right now in helping to integrate medicine for women.
I agree. And we have a lot of female providers in the VA, a growing number of female providers. Used to be mostly men. But more women providers, and that's a good thing for all the veterans, I think.
And it is the VA has transformed itself. It's incredible to see what's happened, to go from inpatient to outpatient. The physical plant was designed in Minneapolis as an inpatient hospital, and there have been a tremendous number of changes year by year to make it work. To deliver the kind of care that they need to deliver today and in the future. But there's been an ongoing commitment to say we are going to get where we need to go. And whether it's a spinal cord unit or a polytrauma center or any of the other investments that have been made, it's to make sure that the resources are there for the veterans who need them.
And I would say, you know, we have a wonderful Secretary for Veterans Affairs, Secretary Shinseki. He is a retired 4-star general. he understands.
People are asking about
Yes.
him now when they're taking a look at women veterans and taking a look at how responsive he is to women's veterans issues.
I would say he's terrifically responsive and very, very supportive of all efforts to make our services more gender specific and gender focused as appropriate. He actually has 3 initiatives for us that he wants us to keep in mind in everything we do. He wants us to be patient-centered. He wants us to be forward-thinking. In other words, think about what we need into the future, not just today, and to be results-oriented. That everything we do ought to get results, and we ought to be able to measure those results. And if it's not working and we're not getting results, try something else.
And you're a good example of that, because the VA measures hospital against hospital, clinic against clinic, region against region, and the only way you're able to get better is to measure what you do and compare yourself against others. And that's been one of the real secrets in the transformation of the VA healthcare system.
And Milton Schoen, Director of Hennepin County's Veteran Service Office, how do you believe that you work with the VA, and how does that best work for you and all of the veterans that you serve?
We have a great partnership, whether it's enrolling people, getting people in emergency situations. We have a Veterans Court in Hennepin County, the first one in the state, and that couldn't be in place if we didn't have the cooperation both of Minneapolis VA Medical Center, the St. Cloud VA Medical Center, and that's going to be replicated. But there's a desire to serve people and solve problems, and that's a common thread that runs here, and there is less turf holding than there is in other places. There's a genuine desire to solve problems and a willingness to do so.
And one thing I must mention, and that is the focus on homeless veterans. The Secretary has given us a mandate to end veteran homelessness within the next 5 years. And that means he wants no veteran on the street or underhoused. And we are making huge efforts to do that. There was a lot of work underway already, and that is an area that we must partner with the community, because we can't do it all ourselves. And we have been very successful in Minnesota in partnering to reduce veteran homelessness.
And Janet Murphy, Director of the VA Midwest Healthcare Network. That's a big mouthful.
It's a big network.
It's a big network. You have to guarantee us that you are going to come back and tell us more that you're doing and the changes that are taking care, and tell us more about the changing role for women and for homelessness in the VA. Thank you so much for coming
I'd be delighted.
with us today.
Thank you.
And Milton Schoen, thank you so much for being here today.
Thank you, Judy.
Stay tuned. We'll be right back. But you know what? We really want to thank you. And please let us know, and keep letting us know, what's important to you, so that we can bring you what you want to know about veterans.